Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to Fronteras at Changing America. I'm your host, Anthony Moreno. A new report from New Mexico Voices for Children has New Mexico with the highest rate of workers without paid sick leave. The report, The Case for Paid Leave in New Mexico, was authored by Jacob Vigil, research and policy analyst with New Mexico Voices for Children. He joins us right now to talk about the policy report. Jacob, thanks for joining us. I want to hear first, why does New Mexico rank so low?
Yeah, so we know that New Mexico has a number of challenges. We know at New Mexico Voices for Children, we often say and highlight the fact that New Mexico ranks 50th in the nation in child well-being. We have the highest child poverty rate in the nation and the highest number of working families who are in poverty. And the ranking for paid sick leave, the New Mexico having the highest percentage of workers without paid sick leave, largely probably has to do with the fact that low wage jobs are highly overrepresented in the state, and so those who can least afford to lose any of their income because of having to attend to a sick child or their own health needs, those are the ones who most lack the access to paid sick leave.
Okay, so can you kind of give us an understanding of where we are across the state? I know Bernalillo County recently passed something to where they would have paid leave for the unincorporated areas of the county. Is there anything else across the state that is even close to this?
I think that the Bernalillo County, the passage of a paid sick leave in the unincorporated areas of Bernalillo County, that certainly was a significant win. I mean, that will pull the numbers up considerably. Those who actually do have access to paid sick leave in New Mexico tends to be provided by their employer. So it really varies depending on the industry, depending on the size of employer. There aren't too many local jurisdictions that we know of yet that have really expanded that sort of mandate for private employers to provide it. But it's a similar picture across the country, is that it really sort of varies and depends on the industry and on the private employers as to how and to what employees they extend that benefit to.
So could you give me an understanding of what demographics of employees this is really impacting the most?
Right. Well, it really, we believe, will have a disproportionate positive impact on those who are in sort of the service industry and in low paid industries that traditionally do not offer paid sick leave. So really, those who up to this point have not had access to that benefit, and particularly those young sort of millennial workers who are really, we know in our state, are the vast majority of those who are having children and are raising our children, particularly parents of color are highly overrepresented among those who have not traditionally had access to paid sick leave. So we believe in Bernalillo County now the extension of that benefit will really benefit those parents in particular.
So your report says that paid sick leave could make a dramatic impact with the economy here in New Mexico. Can you kind of give us a understanding of how that could really happen?
Yeah, definitely. So paid sick leave and paid family medical leave they're good for employers, they're good for workers, and they're good for children. So it leads to safer work environments, greater productivity. We have reduced healthcare costs. When workers are not having to choose between coming into work sick, there's a decrease in communicable diseases. And it's great for workers. I mean, those who we're really trying to, and we need to attract a healthy, vibrant, young, and diverse workforce in New Mexico. And having this benefit, knowing that their employer will provide this benefit so that it doesn't add additional stress, to them when young parents are thinking of raising a family. That's a considerable boost to the economy because it strengthens those families. And we know that for early childhood development, it's also particularly crucial because routine checkups, particularly for newborns, are really important. So when parents have the opportunity to go to leave work and to take their kids to those appointments, there's research that shows that that policy leads to better health outcomes. So, not having parents needing to choose between their jobs and caring for themselves and their family members really just, contributes to a healthier workforce overall.
Okay, now you brought up a couple of things right there besides the economy, public health and also healthcare. So give me a better understanding of how that can really make an impact for New Mexicans in those two categories.
Yeah, definitely. So, I mean, we know that just when people have the opportunity to take time off and have the resources, and again, paid sick leave, paid family medical leave is really just sort of one in a suite of policies that really are pro worker, pro family, and pro child, in the sense that they're shown to really contribute to positive public health outcomes in the long term. So, when parents and families, when workers have access to health care, when they can get off work and not have to worry about losing their job, losing their income, it lowers the incidence of communicable diseases in the workplace. It lowers the cost of health care because people are able to go out and seek preventative care. And then again, with the childhood piece, parents having that benefit are able to really get the care for the children that they need. And so, I would love to continue to emphasize that it's really those who can really least afford to have a gap in their income or a gap in their employment that have tended to not have this benefit. So for those who are really working, those sort of low income jobs or really just starting out in the economy, it's a big boon for them, and it really sort of gives them a leg up, along with other policies such as having Medicaid available for children, having subsidized childcare for families. It's one of those things that we know that that just can strengthen our working families, who are really the backbone of our economy.
Okay, so you brought up something there that I think is really kind of important to dive into a little bit, and that is making me kind of wonder, is there a wealth disparity when it comes to paid sick leave?
Yeah, well, I think paid sick leave can be one policy tool in terms of redressing some really deeper kind of historical and long-standing wealth disparities by race in particular. So we know that we know there are racial disparities by race, and so that has implications all throughout health, education, and life outcomes. And so by having access to paid sick leave, we really sort of eliminate one of those barriers. So when a family, particularly families of color, millennials, we know that 75% of the children in New Mexico are children of color, and the young parents who are raising them particularly those of color, tend to not have access to. They don't have the resources to sort of fall back on if they were to lose a job or have a gap in employment or have a considerable healthcare expense for them and for their children. So paid sick leave is really it's part of a safety net. It allows them to attend to the health needs of them and their family without incurring a huge hit to their assets, which are already, we don't disproportionately, young people working in service industries, people of color, just don't have access to that many assets. So in that way, it does sort of redress that racial wealth gap that really, more than anything, really contributes to disparate outcomes throughout the lifespan for children. I mean, we know that it's unfortunate that your educational outcomes and your health outcomes are far too determined by the economic status of the family and where you were born. So it's one aspect of a safety net policy that can really redress that.
Okay, so from the answer you just gave me, I'm taking from it that there is also a race disparity as well included in this.
There definitely is. I mean, we know there's an abundance of research that really outlines the racial wealth gap, and not only the racial wealth gap, but the racial gaps in disparities in health and education outcomes. And that's not just in New Mexico, but that's nationwide. And at New Mexico Voices for Children, we're a child advocacy organization, and we really believe that racial equity, given the history of our state, given the demographics of our state, really has to be central to all the policies that we pursue, which really are focused on children and working families, because that's really who we're talking about. That's what we're talking about. Black and brown kids, kids of color who historically just have not had that equality of opportunity to really reach their full potential. And so, that's why we're always sort of highlighting the data, but also research-based policies that have been shown to really work and tackle those racial disparities.
So we know this year it was a big part of the legislative agenda of the governor and the legislature to do something about education, especially early childhood education in New Mexico. Obviously, many folks are aware of the lawsuit that has New Mexico not doing enough to educate students who are at risk. So why are lawmakers not talking about this issue if you say this is such an important aspect of public health, the economy, and healthcare costs in New Mexico?
Yeah, it's a good question. I think a huge portion of the state budget goes toward education, and I think that traditionally that's sort of been seen as a major leverage point in terms of how can you impact. How can you boost the economy? How can you impact inequality, right? That having that access to high quality and culturally appropriate education. I think that, there is increasing attention, increasing awareness, and it's a big part of what we do, is really trying to increase the awareness of how, these systems don't exist in isolation or in a vacuum. So families who lack economic stability, who are struggling to make ends meet, month by month, or who have children who grow up in poverty or grow up being exposed to adverse childhood experiences, are much less likely to succeed or even enter school ready to learn, ready to succeed, and are at risk for adverse health outcomes throughout their life. So having family economic stability, whether that's through paid leave or the Working Families Tax Credit, which is another big thing we worked on, or subsidized childcare so that parents can work and go to school and their child is in a safe, learning-rich environment. These are, we've long known that these are really critical pieces for for addressing not just racial equity, but just building a strong economy, a strong workforce. And I think legislators are starting to understand that we had a really historic expansion of the Working Families Tax Credit. We've continued to have increases in the budget for childcare and for preschool, and those will continue to be things that are going to be front and center on the legislative agenda and the agenda of advocates in the next session and beyond. So
So can you give us an idea or an understanding of what states are really ahead of the curve when it comes to paid leave?
Right. So, you hear in the conversations about paid leave and these kind of benefits, you often hear that, well, the United States is the only industrialized nation that doesn't have, a national paid sick leave or national paid family medical leave. And that's, I think that kind of speaks for itself. All the other rich countries really have this and have thriving economies. And so it's something that we as a nation are really kind of behind in, which has really kind of left it up to states and local jurisdictions to kind of pick up the slack and say, no, this is part of having a strong workforce. It's part of, the safety net to lift, kind of lift everyone up, and not only make them able to be, stay in the workforce but also contribute to the health and well-being of their families. So, in New Mexico, we've looked to Colorado, we've looked to Washington State. I believe nine or 10 states have passed paid sick leave laws where where employers are required to provide sick leave, and those look different in different states. So it can easily be done. We again, our neighbors, particularly in the West, Washington, Oregon, Colorado, have shown that they've moved forward in that. California has long been a leader. So we're not starting from scratch. I mean, we know these are things that have been passed and have started to be implemented, and research has shown good positive outcomes from them here in the U.S. and globally.
So what do you think's going to have to happen here in New Mexico for it to catch up with those states in the West, on the West Coast, the Pacific Northwest, and the Northeast when it comes to paid sick leave?
Yeah, well, I mean, the passage of the ordinance in Bernalillo County, our state's largest county, I mean, that was a really great start. It was a long fought victory, and I think that will sort of provide a model or an impetus for further action, hopefully, on the municipal level and then the state level. And I think there was also paid family medical leave legislation that did not make it through the last legislative session. So I think it's really going to take a bold vision, a bold and comprehensive vision on the part of our lawmakers and our policymakers to understand that, in a time where we have unprecedented surpluses because of oil and gas revenue, and our budget is in the healthiest place that it's been in a long time, making those investments in working families and children, the future of our state, the foundation of our state's economy. I mean, that just makes sense. It makes sense for New Mexico, and I think having the long-term vision to make that investment and to position New Mexico as a leader in those kind of policies, that's really going to be, I think, the challenge before lawmakers.
Well, a lot of folks are probably curious about how much is this going to cost to really put forth this whole paid sick leave agenda legislation. I'm sure there are a lot of businesses who are kind of wondering on how they're going to be impacted. So do you have an understanding of really how this is going to impact the state? Do you have perhaps some data on how much it would actually impact each employee or employer in the state? Or would they save a lot of money?
Yeah, I mean, we believe that in the long term there would be. It's in the interest of employers because they'll have a healthier workforce, they'll have greater productivity, a more stable workforce, and it's just an incentive. I mean, it's a draw to workers who they want to work in places that give them that stability, that safety net. So I think in the long run, there's a lot of factors that really make it in the interests of employers. I think, the different policies differ in terms of how they divide up the employer and the employee's contribution. We had some rough estimates in our report just based on sort of calculating the number of hours and wages and just like what that would cost per employee and for employers to provide that. and we think, it's really not something that's going to be incredibly onerous. I believe that in many of the states that have passed it, that the employee actually shoulders a lot of the cost of that. So it's sort of like a deduction that comes out of their paycheck, and a contribution to like like an unemployment insurance type fund. But yeah, I think that there's a lot of analysis out there. I think as we see, from other states how that shapes up, we'll be in a better position to kind of show what the numbers are behind that. And I think that that's also the task for advocates and those of us who are trying to promote these policies, is that we have to have the numbers right and show that it's worth it. It's not onerous to employees, and it's worth it in the long run.
Okay, so your report took a look at different states and what they're doing. I'm kind of curious, are there certain sectors that perhaps offer paid leave, and are there certain that are most likely not going to offer paid sick leave?
Yeah, I mean, generally it's been sort of what are called high skilled jobs. Those in information technology and professional services that have traditionally offered that. I think manufacturing has always really been on the low end in terms of not those workers not having access. Definitely the service industry. And so, I think that's where these policies will really make a big impact. I mean, New Mexico has the highest rate of workers without paid sick leave, but we're at about half. So, I mean, if you figure, like I said before, I think we have our workforce is overrepresented in those sort of low paid jobs, and so. But that also means that half of our workers do have access to paid sick leave, and that's through, generally it's through their employers. So, yeah, I think in those industries, passing these policies will really have that disproportionate benefit.
What is the role that unions play in paid leave? Do you have any data or research that shows how unions make an impact, or employers who have unions available for their employees? Does that make an impact on whether these positions have paid sick leave?
I believe the data shows that those industries with heavy union representation do tend to have more access to paid sick leave and paid family medical leave.
Okay, so in New Mexico, during this conversation, you've talked about New Mexico obviously having a lot of low-wage jobs. With so many people in New Mexico making low wages, how does that really play a role in paid leave actually happening in the state? I mean, they're just worrying about getting by and making ends meet, and so how are people actually going to push legislators to actually make a difference with this issue?
Yeah, well, I think that I mean, we has had a historic increase in the minimum wage in this last legislative session. I think that's something that that's been the trend nationwide. It's something that was long in the works, and so pro worker, pro family policies are, I mean, we know they're interconnected. We know that in order to have a strong workforce, we have to have all of these things. We have to have high wages. We have to have high skilled jobs, high paying jobs. I think, yeah, it's just one of those, one more piece in sort of presenting to our lawmakers, what options do they have for, strengthening New Mexico's economy. There are many others, and I think, as a child advocacy organization, we do tend to really put our attention, our focus on those that will help working families. We know that in New Mexico, we have the highest rate of families who are working people who are working that are still in poverty, right? So that's, access to paid family medical leave, paid sick leave. It's just one more thing that can kind of make the difference between a family really, being able to work and strive and build up savings and wealth and take care of their family, and falling into like an emergency, like a medical emergency, or loss of their job that could be catastrophic for their family's well-being, and having that in place, for a considerable amount of families, I mean, that's going to make a huge impact.
Jacob Vigil, he is a research policy analyst with New Mexico Voices for Children. Thank you so much for joining us and talking about such an important issue.
Thank you.
And we want to thank you for joining us on Fronteras at Changing America. I'm Anthony Moreno. Remember, we are on social media. You can keep up with us by liking us on Facebook, following us on Twitter and Instagram, and you can also subscribe to the KRWG News YouTube channel where you can watch many episodes of this program. We'll see you next time.